In this lecture, we are focusing on common GI procedures and the MA role. This session matters because GI clinic is not just about talking through symptoms. Many visits connect to procedures, and those procedures depend on accurate preparation, medication review, patient instructions, specimen handling, and follow up support. In other words, the MA role helps determine whether the workflow is safe and whether the procedure process goes smoothly. To keep this organized, let's start with the procedures themselves. A colonoscopy looks at the colon and is used for things like colon cancer screening, bleeding, anemia, chronic diarrhea, change in bowel habits, and some abdominal symptoms. And EEG, also called upper endoscopy, looks at the upper digestive tract and may be used for reflux, ulcers, swallowing problems, nausea and vomiting, bleeding, or upper abdominal pain. A flexible sigmoidoscopy looks at the lower colon or rectum in selected cases. And capsule endoscopy then involves swallowing a camera to look at the small bowel. ERCP is used to evaluate or treat bile duct and pancreatic duct problems. Endoscopic ultrasound, or in the US, wow, is used for selected pancreatic bile duct and GI wall problems. Some patients may need HyCRO-PEG tube placement, which is a feeding tube procedure. Others may need liver-related evaluation, such as liver biopsy, a fibroscan, or other liver imaging support. You do not need to be able to perform these procedures or explain them in technical detail, but you do need a clear, simple explanation of what they are for, because patients will ask questions and because the workflow surrounding them is where MA accuracy really matters. Now, let's break the workflow into before procedure responsibilities and after procedure responsibilities, because that is how it is actually experienced in clinic. First, confirm identity using two identifiers. This is basic safety, but it matters every time. Next, collect a focused history, verify allergies, and review medications. One of the most important medication questions is whether the patient is taking anticoagulants or antiplatelet medications, because missed blood thinner history can create serious safety issues. You also need to document the patient's last oral intake. Review, bowel prep, and NPO instructions. Confirm that the patient has an house escort or ride. If sedation is planned, obtain vital signs per workflow and support the consent process as directed. Let's pause on bowel prep because this is one of the highest risk workflow areas. Patients are often confused about prep timing, diet restrictions, or when to stop drinking fluids. If prep instructions are unclear, the colonoscopy may be incomplete or need to be repeated. That creates frustration, delay, and risk. Good prep teaching is not a small task. It is one of the most valuable contributions an MA can make in GI practice. Now think about the period after procedures. The MA may help reinforce discharge instructions, review warning signs, assist with specimen labeling and transport, help with room turnover and infection control, document appropriately, and support follow-up or pathology tracking. Again, these may sound like small steps, but if they are done poorly, real problems happen. For example, specimen labeling errors are a major workflow risk. If a tissue sample is mislabeled, the pathology process can be compromised. Failure to give clear discharge instructions can leave patients unsure what symptoms are normal after a procedure and what symptoms require a callback or urgent evaluation. Missed escort questions can create major problems when sedation is involved. This is why checklists matter in GI workflow. A reliable pre-procedure checklist helps you confirm identifiers, allergies, medication review, blood thinner history, oral intake, prep completion, and ride arrangements. A reliable post-procedure checklist helps you reinforce warning signs, confirm specimen handling steps, support room turnover, and document follow-up needs. Let's run through a few practical scenarios. A patient arrives for colonoscopy but says they were not sure whether they were allowed to drink clear liquids that morning. That is a prep problem that needs clarification before the day proceeds. Another patient says only at the end of intake, "Oh, I'm on a blood thinner." That is not a detail to casually note for later. It needs prompt attention. Another patient has sedation planned but says their ride may or may not come. That is another workflow issue that can affect whether the procedure can proceed safely. The practical lesson is that safe GI procedure support depends on disciplined attention to details that may seem routine. Identity checks, prep review, medication questions, escort confirmation, specimen labeling, discharge teaching, and documentation all matter. As an MA, you help hold the process together. You are often the person making sure important details do not slip through. In GI clinic, that is not just efficient workflow, it is patient safety.